Renal tubular function testing. Two important clinical tests, renal tubular function identifies. So one of the important function of the renal tubule is your concentrating capacity, concentrating urine. So how do you test that? You deprive a patient 12 hours of the for water deprivation test, 12 hours no water, and you see whether it improves the osmolarity or not. So if naturally when someone is not taking water, its urine will be concentrated, osmolarity will go up. When tubular defect is there, these things will not happen. The 750 milliosmoles per kg, the specific gravity 1.022 is said to be a diagnostic cutoff. When they do not occur, you have the tubular disease. Normal osmolarity is how much? 50 to 1400 milliosmoles per liter, and the specific gravity normal is 1.0012 to 1.035. So, failure to improve the osmolarity by water deprivation is diagnostic of the diabetes insipidus. When it improves with the ADH or vasopressin, you have primary, that is central pituitary deficiency, pituitary disease, lack of secretion. And when you have do not have this improvement with the ADH, the minerin, they usually we test by IV route. Then you have the nephrogenic diabetes insipidus. So this test identifies concentrating deficiency of the kidney. Renal tubular acidification is another test that detects the acidifying capacity of the urine. Normally, urine is acidic. Its pH is around how much? Less than 5.5. So, in the renal tubular defect, like suppose in renal tubular acidosis RTA, proximal distal, and few more other tubulopathy, what you have excessive bicarbonate elevation, you have or retention of the hydrogen ion in proximal and in distal respectively. So in those cases you have acidosis. So give an alkali and see, that is, you give either sodium chloride or ammonium chloride and see how much it improves your the urine and the serum, your acidification. So if the infusion of the bicarbonate improves the situation, that is the metabolic acidosis is being taken care of. It is a measure to know that the defect is in the tubule, proximal and distal, and diagnosis is RT. So this is the test way that you test the urine acidification function of the renal tubule. And the in other tubulopathies like Bata, Gentleman, and few more, Dent, and few more, they have their own investigations. And then finally, these diseases have genetics, good amount of time. So testing for the genetics, underlying gene defect, identifying that gene is perhaps the diagnostic.